Okay, do we have other people to speak on this topic today? How many people want to speak on this topic today? Okay, can we limit you to 3 minutes? I know, because it's almost 3:30 and we still have a lot of other things.
Or I can
Yes.
do that for you, and then that way you can start your thank you direct. Thank you very much. It's just the bill.
Good afternoon. I'm Paul Hansberry. I'm with Lovingly and Legally. Good to see you all again. Thank you for giving me the opportunity. What I'm passing out here is in fact a copy of Bill 2215, which is a spot bill. And the letter that you got from Assemblymember Calvert encourages the dialogue so that we can get the proper language put together. Along with this packet is something that we got from Legislative Council that's been vetted, and this is our approach to this. A lot of the problems that we've been talking about. It's a multi-tiered approach. First of all, it gives the veteran, first of all, is the safety of the animal. That's first and foremost. With the advent of adult use, the possibility or likelihood, no matter how well-intentioned, of a toxic dose being administered is highly likely. Secondly, giving the veterinarian the ability to not only discuss but to recommend. We define veterinarian as someone who's licensed in good standing with the Veterinary Medical Board, but then we go further to a qualified veterinarian. Qualified veterinarian is not only a person that holds a license in good standing, but has also taken a continuing education course in veterinary medical cannabis. We figured this was one of the pieces that was missing with the medical piece, with the medical doctors, is that they would just be able to recommend, and then everyone was self-medicating. So if the veterinarian knows what they're talking about, at least to as much as they could know, and they took this certified course that was race approved and approved by the board, that they would be a qualified, then they would be able to recommend. And the recommendation would then be able to be taken to a medical retail outlet so that they could buy veterinary products. Even if the person didn't, the pet owner did not have a recommendation from their family doctor, they could get into a medical retail outlet showing this, and they would be the caregiver for the patient. We were looking into this, and so I started to research to find out where we could find a continuing education for medical, veterinary, cannabis, and there were none. So I reached out to some people. There's a couple of doctors, husband and wife team, Meredith and Steve Korn from Harvard Medical School. They do continuing education on many, many topics in the medical field, especially for medical cannabis. They're known for that, although they've done other things along, and not just limited to medical cannabis. But they did write the continuing education for Florida, for New York, for Massachusetts. They've got accolades internationally for their work with medical cannabis. They have a website called the Answer Page, where anyone can go on and get the question of the day, but you could certify and you would be accredited. And this could be race certified. Also, the American Humane Society has an appointment in June. They're going to be filming another one that will be race certified as continuing education just for veterinary. So we've already done that work.
Okay, just 3 minutes are up, and I have a couple questions. So, in just kind of quickly looking through this paperwork, so it looks like that it says that by July 1st, 2019, the board shall approve medicinal cannabis continue education programs that at a minimum provide training on the endocannabinoid system, dosage of medicinal cannabis, and where are we supposed to get that, and side effects on the use of medicinal cannabis on a patient. So we don't have a dose.
There has been people doing independent research that will contribute to that, and I believe that the dosage would start with a tritated.
And so
I'm
in
not
this
a
bill
veterinarian.
anywhere, do you have any money for research?
This is what I'm saying.
Just asking,
Personally.
just asking.
The research would be done, as Dr. Sullivan said, by, between the different, because they don't have the same HIPAA privacy laws that medical doctors have, not the client information, but the patient information, the medical records, they could share with each other. This worked, this didn't work, and this would promote the research, not only in the veterinary community, but also throughout the healthcare system, because they could share this information with medical doctors and other researchers.
Okay, thank you.
There's one other piece. It does mention something about it gives the board, the BCC, the authority to create a new license called veterinary retail. This was forward thinking. This is not a requirement. We saw that perhaps the reduction of medical cannabis dispensaries and for access, but this is just a placeholder that gives them the authority to do it if something changes on a federal level, so that they could commingle the Schedule II, or if it was rescheduled or descheduled from a Schedule I substance.
Okay, thank
So it
you.
wasn't a requirement.
Okay, thank you.
Can I yield my 3 minutes to Mr. Hansberry, because really it's the same issue, and it will shed light on some of the questions that the board has addressed.
Yes, that's fine.
Thank you very much.
So, having the safety of the animal is first and foremost. They should get the information from the veterinarian. I think we all agree with that. Getting the information at least out of the gate, what we know now from experts who are experts in the field, either from human with input from other veterinarians that have been doing independent research, and we have access to those people to at least start the thing. The continuing education would continue and be developed. If you go to the answer page, you'll see that those things are constantly updated. The third piece would be the veterinary, that it's only sold in medical cannabis because it's medicine. The days of, a wink and a nod for medical cannabis are gone. We've got adult use, recreational use. There's no recreational use for animals. I'm sorry. So then they would take the recommendation to the medical cannabis dispensary. They would be able to purchase a veterinary product, only veterinary products. They couldn't purchase other things with that recommendation. That way, if the pet owner did not have authorization from his family doctor, but he couldn't go in with just his family doctor and do that. And that restriction would help to keep the research so that it wouldn't be skewed, because other people would be doing other things, and the veterinarians would be able to pool their resources and their results in order to further the research. We know that it's a spot fill. What we would like to do, what we would like to hear from you is feedback on these points here, and perhaps feed them back to Assemblymember Kalra, so that we can get the language and do it right. We think that it's really important, I think it's been mentioned a few times, that we get this done right out of the gate, rather than watering it down and saying, oh, I wish we'd done that, where things would happen, and they would be irreversible, because you've already signed that.
Okay,
So
thank you.
very much.
Thank you.
Hi, my name is Tim Hsu. I'm a California veterinarian. I'm the founder and CEO of Vet CBD. We are a cannabis company that makes products for pets. We've been doing this since 2015. We've been doing it all across California, and we serve thousands and thousands of clients across California. I want to share with you my experiences with cannabis and pets. The primary uses that we use it for, as it has already been mentioned, is pain, particularly chronic pain and neuropathic pain. We use it for separation anxiety, noise anxiety. We use it for inflammatory conditions. We use it for nausea. And so when it comes to loss of appetite, a lot of times it's associated with nausea. So we use it for a lot of kidney failure patients, liver disease patients, chronic GI conditions also. And we also use it for seizures. We have a lot of patients that use it for epilepsy. And it helps to decrease the severity and the frequency of those seizures. We've also seen it used for cancer symptoms, cancer pain, and at certain doses with certain patients, we've actually seen sizes and tumor reduction. So there is valid uses for cannabis, especially when it comes to pets. And the primary reason for that is because they have an endocannabinoid system. And the endocannabinoid system consists of cannabinoid receptors and their endogenous ligands. So as people, as animals, we all create cannabinoids within our own systems, primarily anandamide. And so that's the fundamental basis of why cannabis is able to have these therapeutic effects in pets and animals as well. And the reality is that the cat's out of the bag. And as veterinarians, as a profession, we're behind the ball on this. There's the market is being flooded with pet products, either hemp or cannabis, and the information that they're getting it from is not their veterinarians. The discussions that we have with clients is that they want to be able to discuss this with their veterinarians. Many of them have asked their veterinarians about it, and the veterinarians have told them that they can't discuss the issue with them. And so what happens is they end up going to secondary sources, sources that should not be their primary sources. The reality is that as veterinarians, we hold a moral and ethical obligation to find the optimal therapeutic treatments for our clients and for our patients. And if cannabis offers such a therapeutic option, then it's our obligation to seek that out. And so that's the basis that where we come from, and this is why I started the company back in 2015, is so that we could offer this to pets and their owners. And the results have been very clear. And there's a reason why we're still around, and there's a reason why I know many veterinarians that use cannabis for their own pets. That might come as a surprise to people, but we do talk to a lot of veterinarians that use cannabis for their own pets. And as far as the question of whether these are cannabis naive people, some of them are. Some of them have never had anything to do with cannabis, and their first exposure to cannabis is because their pet is using it. And so, interestingly enough, they actually see the benefits through their pets rather than themselves. In an ideal world, we would do things the way that have been discussed, but the reality is that due to the prohibition of cannabis, the myths and the misinformation surrounding cannabis has made it a Schedule I drug. Oh. And it should not be a Schedule I drug, but that's the reality, and that's where we stand. And as health professionals, it is our duty to be able to get on top of this and to be able to educate our pet owners. As veterinarians, we are the primary source of information, but by preventing veterinarians from discussing this issue with pet owners, what we're doing is we're forcing them to find information from secondary sources.
Okay, thank you.
Sources that are not as reliable.
Thank you.
Thank you. You have a question? Yes, Mark.
So you're selling these products. Do you also provide information on indications for those products, dosaging, contraindications for the product, drug interactions, things like that? And if so, where did you get that information from?
Yes, we provide indications and we provide dosing. And what we do is we do our own private clinical trials.
And what does that entail? Just like surveys?
No, actual pets that have conditions, and then what we use it for is, what we do is we apply cannabis therapeutics to them, and we gauge their response and we gauge their clinical signs, just like how you would with any other medication or treatment.
Okay, thank you.
Thank you.
Yes,
I'd like to give my time to Dr. Shu as well.
okay.
I also think you could provide a little
You
bit of-
We
can't-
can't
you
talk
have to-
back. It's
Yeah.
because the microphone doesn't pick you up.
Yeah, I mean, I think that primarily what needs to happen is we need to get on the ball, because the more that we delay this issue, the more that we choose to not allow veterinarians to speak about this, the more it gets out of the veterinary profession's hands. The more it goes into the industry, the more it goes into secondary sources. And fewer veterinarians are going to be involved in this, which is not what we want, because this is medicine, this is treatment, and this is something that veterinarians have to be involved in. The endocannabinoid system is real. It's always existed. The fact that it's not really taught in schools right now is unfortunate, but it's also one of the reasons why I give lectures to veterinary students, is because they need to learn about it. They have questions about it. They want to learn about it. 10, 15 years from now, it's going to be standard education for veterinary students to learn about the endocannabinoid system. And so to prevent discussion of the endocannabinoid system is to say, It's the equivalent of saying that we can't discuss the endocrine system.
Okay, so,
Judy,
okay, sorry. So, doctor, you're a veterinarian in this state.
Yes,
Okay. And you know the law right now is that vets can't discuss it, they can't recommend, but yet you've been doing this since 2015 and you're here today telling us all about it. When you knew that this could put your license in jeopardy in 2015 that you started doing this, what compelled you to go above and beyond what the limitation of your license to do this, and why you're here today telling us that you've been doing this, which is actually against the Veterinary Practice Act. So obviously it's all very wide open. So tell us what compelled you to do this and to come today before us?
sure. I would like to make clear that I don't practice. So since 2015, I have not practiced.
Oh, you're not a practicing
Right.
veterinarian.
I'm
Okay.
not an active practicing veterinarian. I
Okay.
run Vet CBD full time.
Okay.
The reason why I started it was because I believe that veterinarians have an ethical and moral obligation to seek out the best course of treatments for their patients. And if cannabis offers such therapeutic options, then as health professionals, it's our duty to seek those options out, to explore them, and to be able to discuss them.
Okay, so then these clinical trials weren't exactly in a clinic then, if it wasn't at a licensed veterinarian. The
Correct.
clinical trials were more, okay.
They're
this is
private.
more anecdotal,
Yeah.
anecdotal.
I mean, it's field evidence. It's evidence that we've gathered. So you can say it's anecdotal.
I just had to
Dr.
ask,
Nunez.
thank you.
Well, just actually, so you don't currently have a license as a veterinarian,
I do,
but you're not practicing?
correct.
Okay. The other question I had was, it seems like the public right now feels that marijuana will help everything. So is there anything that marijuana won't help? And if the
Absolutely.
answer is no, then doesn't that seem a little outrageous?
The fact is that marijuana does not help everything. There are specific conditions that we recommend it for. And that's part of the information that needs to go through veterinarians. Because if the public is thinking that marijuana can solve everything, then the veterinarians need to be able to be the ones to clarify that for them and say, no, that's not the case. There are specific conditions which marijuana may be beneficial for, but it is absolutely not the case that marijuana can fix everything.
I'm glad to hear that because that definitely is what the public thinks right now.
And that's why we need veterinarians to be involved in that discussion to be able to clarify issues like that. Because if we don't, then they're going to seek secondary sources that say things like that.
Kathy,
Yeah, I was just, I'm not really looking down, reading something else. I'm looking at your website while we're doing this. And I just had a couple of questions. So you said your products are products, you're a for-profit company, and they're sold at medical dispensaries or cannabis dispensaries now in California. Is that correct?
Correct.
The clinical trials that you are talking about, are those, I assume probably they're sponsored by some of the companies that are producing the cannabis or the particular strains?
No,
Is that how they're?
It's all done through our own company.
Your company is privately doing clinical trials on animals?
Right.
Okay. Okay, thank you.
Thank you.
okay, thank you.
Thank you.
Yes, next.
I have some materials for the board. Good afternoon, President Waterhouse, members of the board. My
Can
name
you-
is Charles Lozo. I'm an attorney, practiced for 30 years, admitted in New York and California. I grew up on a farm and I've had my arm farther up in a cow than I would care to admit, but I just have. The reason I'm here today is I'm also the founder and owner of Right Ratio, which is a company in Southern California that provides cannabis to pet owners for 3 specific conditions: cancer, arthritis, and seizures and severe anxiety. We've been doing this since 2016. We're a data-driven company. We have made over 400 formulations and developed our own software to measure milligrams per milliliter of all of the cannabinoids that can appear in an extract that was prepared here in California. What I would like to convey to the veterinary board is a very narrow issue, which is embodied in 2215 today. And I think it's of paramount importance because the number one concern I have is animal safety. I believe 2215, as written, discussion and recommendation is essential for the safety of the animals and the integrity of the profession. As Dr. Shu mentioned, the cat is out of the bag. The marketplace will take over in a vacuum. And a vacuum exists if veterinarians are not there to lead the way. And I would urge the board to recognize that, yes, it's a long, complex road with cannabis legislation. From 215 to SB 94 and MRSA when it was first drafted and amended through Prop 64. There's nothing, no one organization can write one piece of paper to solve that. But without 215 and veterinarians leading the way, animal danger is very high. The profession is compromised severely. In the documents I gave you, I took an informal survey of my clients. And granted, it was through software that I'm not tremendously great at. But the survey said 97% of respondents supported vets recommending, being able to recommend if appropriate. 85% had attempted to discuss it with vets. The second document has the comments to those surveys, and you'll see in there what real pet owners are facing. The last thing I'd like to say to the board is, because, and I share Dr. Shu's views, medical cannabis does not solve everything. And I never want to expand my approach beyond the 3 areas that I've looked at for almost 2 years now. And I have 400 data points and over 3,000 communicate with pet owners who tell me how their animals are doing weekly.
Okay, can you wrap it up?
Yes. So I encourage the board, I understand the complexity of it as a lawyer, but if you don't act promptly to put vets in the lead, the market will fill the vacuum. And I would like nothing more than to work with veterinarians directly. Thank you.
Thank you. We have anyone else to speak?
Hello, my name is Dr. Gary Richter. I'm a veterinarian in Oakland, and I'm here to speak with the board today about the position that I think the entire veterinary community needs to take as it pertains to medical cannabis. Like the board, my primary concern regarding the use of medical cannabis is for animal safety. There really can be no greater priority, and as far as I'm concerned, that is the first, second, and third consideration. As far as what we as a profession and hopefully the board chooses to do here. We really need to treat cannabis with the same respect that we would treat any pharmaceutical with. there are people out there that would claim that cannabis is both highly effective medicine and 100% safe. And I think we as medical professionals understand that those two positions cannot exist in the same space. Any medicine that has a pharmacologic effect on the body has the potential to cause problems and have side effects and have toxicity, which means that medical involvement, the veterinary community's involvement in the use of medical cannabis is paramount to its safe and effective use. So I'm here to ask the board today to support 2215 to make sure that veterinarians are able to discuss and recommend medical cannabis for their patients. A little earlier today, during the discussion about SB 27, Dr. Waterhouse, you mentioned that you felt very strongly that medicine should really only be handled by medical people. And that's really what we're talking about today. We're talking about a pharmacologic compound that, as we sit here today, non-medical people are able to go out and purchase and use indiscriminately without any medical guidance whatsoever, sometimes to the detriment of the animal. So, it raises the issue that we as a profession really need to step up. And I know there's some concern that there's the chance for abuse and chance for misuse. And the reality is there's always going to be people out there that are going to refuse to seek medical guidance and use these products on their own. And we as veterinarians, we see this happen all the time when we have somebody come into the office with their limping cat and say, oh, he was limping, so I gave him a Tylenol last night. And now all of a sudden we have a whole bigger issue than a cat with a hurt foot. And that's going to happen no matter what we choose to do from a standpoint of legislation. But the best way for us to minimize inappropriate use of cannabis is to create an open pathway for pet owners to be able to get advice from their veterinarian. What we're really trying to prevent here is irresponsible use, indiscriminate use. If not us, then who is going to take charge of this conversation? During the past 6 months, I've been able to survey quite a number of people. I have responses from 170 California veterinarians who are in favor of the legal recommendation of medical cannabis in California, and over 1,100 concerned pet owners who also are in support of these changes. So we're talking about something with broad, both public and professional support. And I just wanted to address one other thing, the question of the research. I am the first person who is going to stand up and cheer when the research comes out for how medical cannabis can be used. But the reality is that this is a problem that we have to face today. Recreational use is here to stay. There are more and more companies that are coming out with pet-specific products on the market all the time, which means that pet owners are going to be able to go out and buy these products. And if they can't get guidance from us, then they are going to do it on their own, sometimes to the harm of their patients. Thank you.
Thank you.
Mhm.
Hi, Bonnie Lutz. I don't have any comments about the use of medical marijuana in dogs. But what I see is a problem with 2215, and that is the use of the word recommend. I understand completely that there's this, the issue is the continuum between discuss, when does it stop being discussion, and when does it start being recommendation? But what I'm hearing is that there's very little evidence to support the use in animals. Therefore, the actual recommendation I'm concerned about. I'm concerned about my clients getting caught up in that. I'm also concerned that if 2215 passes with the word recommend in there, it gives a message to the veterinarians, oh, now I can recommend it. And as you know, and especially Anne Marie knows, there's basically two ways to get the vets in California. You can go after them for violation of regulations. You can go after them for negligence. Even if we have the regulation or the statute from 2215, that doesn't prevent the vet board from going after a veterinarian for negligence for recommending marijuana use. And so that's really my concern for my clients and my future clients, is to, understand under that framework that we're all kind of looking at 2215 as being the answer to this. I do have a problem with the word recommend. Maybe that can be changed or limited. But I also think that because of the lack of evidence, that a lot of vets are going to find themselves looking at a negligence allegation. And that's really my concern here.
Judy?
Bonnie, do you think the word discuss, I mean, if they're discussing, they're
think
gonna stay
discuss
out
is
of
fine.
trouble then?
I think discuss is fine. And the other comment that I want to make too is that we don't want to force vets underground with the medical records. And something that was sort of
Exactly.
going through my mind was,
Yes.
you've got this off-label use and you're supposed to document off-label use. Now, if you tell vets that they can't discuss it even, then they're probably going to they're going to discuss it, but they're not going to record it.
Mhm.
So what we really want is, if they're going to discuss it, we want them to put it in their medical record, what they discussed, exactly what they said. I think that's going to give us more evidence as far as what kind of clients they're discussing it with. I mean, I think that will be a good thing. And even if we change recommend or limit recommend to, something that's not quite as heavy as recommend, hopefully they will put that in their records. But that's my issue, is that I think discuss is fine, and I would like to see them documented in the records.
Thank you. Oh, did you have a question?
Oh, no, I was just gonna say something about what Bonnie just said.
Okay.
It was more about, Bonnie brought something up that I've been thinking about for a while, and there may be another public speaker. so
Yeah,
maybe
go
I'll
ahead.
wait.
Okay.
Yeah, I'll just wait.
My name's Eric Johnson. I'm a veterinarian at the University of California, Davis. I've been an educator there since 2005. And I don't think there's any doubt, based on what we heard here today, that there's an endocannabinoid system, that cannabis is a powerful drug. My question for you guys is, how do we educate our veterinary students when we teach them to respect peer-reviewed literature? If there's no peer-reviewed literature and there are no double-blinded, placebo-controlled studies out there in the veterinary literature, how are we to educate our students? I also teach plenty of continuing education courses. How am I supposed to teach these continuing education courses and show veterinarians the correct direction to go without evidence-based medicine, without placebo-controlled studies, without even basic pharmacokinetics? I think if we're looking to follow what has been done in people, I think that what happened in the human MD medical industry with cannabis was a massive failure. We missed out. It obviously works for seizures in children. If we look at overseas research in people, it obviously works for certain disorders. But nobody put the time into funding research for double-blinded, placebo-controlled studies, simple pharmacokinetics in people. And I think that's where the problem is going to lie in veterinary medicine. We have the ability here. This is a tremendous opportunity for us to grasp and say, this is the right way to do it. This is the right way to take a Schedule I drug, give it evidence-based medicine, give it pharmacokinetics, give it valid peer-reviewed literature, and get it descheduled from 1 to 2 or 3 or 4 so it can be openly prescribed. And so there's not this stigma that it's a recreational drug, that it actually is a substance which we can use for basic multiple medicinal purposes. And I think without that evidence-based, double-blind, placebo-controlled studies, without peer-reviewed literature to support it, I think it's going to be a massive failure. And I think that it's important that we go that direction.
I agree with you 100%. We have to stick to our values, right?
Correct.
Now, how long would that take?
Well, so we're going to do things the short and dirty way. They did it in the MD industry.
What is your recommendation?
My recommendation would be that we fund cannabis research in an institution which can obtain a Schedule I license to do the research properly. Start with pharmacokinetics.
For $100,000. Is that what we heard?
That was just the beginning.
Yeah,
That was just the beginning.
That's just the beginning. You're right. That is just the beginning. But that's the right way to do it. If we want to unveil the stigma off of of medical marijuana through the veterinary, community. I think there is a stigma out there because it's not well respected in multiple institutions. We need to repeal that with double-blinded, evidence-based, placebo-controlled studies.
Well, I agree. So, here's where I'm at, and I think I might speak for others that I talk to, is that, there's a couple of drugs on the market, mirtazapine, cyproheptadine for appetite stim, right? And they're horrible drugs. They make the animals crazy. So then, they say, oh, well, the cannabis stuff, oh, it's wonderful for appetite stim. Well, I'm afraid to use it because I'm afraid. I know that there's not the regulation and the dosing and the this and that. But if I wasn't afraid and I did try it and it worked, I'd be really happy. And some of my friends have used stuff for seizures and it works. So to hold back, my problem is holding back for some of this top stuff that gets treated. That if we had some peer reviews data that's out there that people have been collecting, and we could get it through the institution and the way things should be peer reviewed and what science really is, right? And get those on the market. I mean, can we do something to expedite the stuff that we know? And then I just don't want it to take a long time when people are using it. They are getting results. The marketing is taking the place of the veterinarians. We're in a really bad place. The veterinarian should be leading this.
But we have a fiduciary responsibility to do things the right way.
I agree.
Yes.
I agree,
Yes.
100%.
Kathy has a question.
Yeah, I support what you just said tremendously. And also what Dr. Richter said as well. I mean, we're in a situation here, but in my mind, if human beings are going to test this stuff on themselves, that's fine. And as far as I'm concerned, it's their issue, their body. But I really don't believe, I believe that it should be done like you're talking about. I want it to be done so that vets can recommend, that clients can accept the medication that cannabis will provide, but based on studies. And I just think, for me personally, I haven't even read the bill yet here, but I'm just not ready to take a position of support. I mean, if we were going to do anything, it would be watch this bill. I understand with all the sentiments here, but I also still think you don't want to rush something, and the animals are the ones that suffer.
But there are studies. I mean, people have been using this stuff.
Well,
it's not like
that's
there's
not
not.
different than a
I
study.
get it.
That's
But
not
there's
a study.
substantial data is what I want to say. There is substantial data.
I agree, but we need peer reviewed,
I agree.
evidence-based
I know.
medicine to support
It's very
this.
frustrating.
And saying it's going to take 20, 30, 40 years,
Let's hope not.
let's hope not, but we can start at this level to ensure that it doesn't take 20, 30, 40 years.
We need a path. We need a path. The Veterinary Medical Board, we need a path here.
You guys have the ability to channel this path and say, you know what, this is the way things should be done, and I think that's important.
And Dean Keep who demands it.
Thank you for your comments.
Thank you.
So I think, is there any other public comments? Okay, I think we need to get back to what's pertinent with the agenda. The comments were very helpful in terms of giving a lively and I think well-balanced discussion about what's before the board. I don't think this is the board's issue to solve in totality. I think the board can take an active role in seeing that this is done responsibly. We do have a bill before us that's been sponsored by the CVMA, and Assemblymember Colra is carrying the bill. At this point, it might be helpful to take a vote on the language here, and perhaps the vote may be we have some concerns. We'd like to see the language continued. We'd like to continue to work with the Assembly member to create something that we feel might be a little more responsible for where we're at today. I think the bill should encourage research. I think that's in the background of the bill, the preamble, if you will. But there's nothing in the language that says the Veterinary Medical Board is supportive of continued research or, allowing the University of California, Davis to research this, and whether or not that's appropriate for a policy committee bill or whether that should go in a budget trailer bill. that's left to be decided by those who know how to navigate this a little better. But I would like to see the Veterinary Medical Board consider taking that kind of position so that it's not just isolated to, discussing and recommending, that we all agree that we need research.
Kathy?
I think this is what basically what you said, Anne Marie, but I would think, I'm not in a position and I'm not ready to take a position in favor of this language now or even of this bill, but watching the bill is something I think we should do as a board, and as necessary, I would assume, have dialogue with the authors, et cetera.
Yeah, so is there a way to say that we're gonna have a more active role in trying to work with the
Well-
author to?
Well, I think you need to
I don't know if you
have
can
an
say that.
active voice. If you want to work with the author's office and continue to work on this language, then that's the,
Watch and work with author.
you could do that. You could watch and work with author, I guess. Watch seems to be
no.
a little more inactive. If
Yeah,
you're
it
actually
does.
working with the
Actively
author's
watch.
office, you're doing something actively engaging in the bill.
Dr. Nunez?
I'll take a wild stab at this. How about if we support if amended? And the amendment would be to exclude the recommendation portion and also to add support for continued research.
Huh? Wait, what?
Judy was first.
I agree. I mean, I wanna ask for funding. I think there's money, for funding, and I think that they should do that. And I agree with Mark, the amending and giving some guidance. And instead of eliminating recommendation, Bonnie alluded that there might be, where is she? Some other words that might not be recommend, but something beyond discuss.
The word's in there, discussing.
Did you have a recommendation for something other than discuss, Bonnie, if you wouldn't mind?
Well, I said if amended, we have to take that out.
I didn't really have a specific word. I think it's something that we should look at, though, because I understand why CBMA doesn't want to just stop at discuss. Because there's a fine line. You discuss it, and then you might say, I can't prescribe it for you. You might want to contact so-and-so.
Maybe they evaluated their best knowledge or something.
Something to that effect, so that you're not just limited to discussing, but you're also not actually recommending.
Right.
Because then that puts you in the difficult situation.
Well,
of
then
potential
you've
negligence.
bypassed all that, what the university folks should be doing. Okay, so yeah, I'm amended. Thank you, Bonnie.
I think that it is wrong to add in research in this, because that's a whole different issue. I think it's appropriate, but I think it needs to be a separate bill.
So
Dr. Nunez?
can I change my motion then to support if amended, and the amended would be to remove the recommendation portion and no longer add the research part?
Okay, is there a second?
I have an idea.
Okay.
I had a second for
Okay.
the research.
Before you
second
say your
it,
idea, can I say something that seems inconsistent? In this particular, in the whatever bill, the Stein North bill, we moved to watch it because it was some of a spot bill, and there were obviously a lot of things they were going to add to it.
Oh, I see what you're saying.
Now I'm feeling that this to do something here for me seems inconsistent to what we did with the Stein North bill. I'm
Yes.
sorry, I just was trying to compare what we're saying about different pieces of legislation. I realize it's a different topic area, but I just want to bring that up.
That's a good point.
Well, to
Dr.
address that point, it goes back to that argument, if we don't do something, somebody else will.
Yeah.
And that's not the same
Yeah,
with the other issue.
And we're not leading.
So, but I think what we're all saying is we need to work with this author to try and figure out the right language.
And if we don't,
Is that what we're saying?
watch will not give us the power to work with the author.
Watch just lets the market, the internet lead and not the veterinarians.
Yeah.
The veterinarians need to be leading. We're a
Totally
state of
agree with
California.
that.
Come
I
on,
just
folks.
don't
Let's go.
agree
Let's
with
lead.
amending the
There's
language.
definitely an active role to watch and work with author. It means
Yeah.
watch it and work with author, and I'm not making a decision until we work with the author. It's a very active position. It doesn't mean sitting on the sidelines and waiting.
Right.
Watch means sitting on the sideline and waiting.
Right.
So I think, I mean, I'm not for that motion, but I think it's an appropriate
Do
motion.
you have a motion, Dick? Do you have a motion?
Yes, my motion is to support this bill. as
I'll
it is.
second it.
Okay, so your motion, say it again, your motion was to
support the bill.
support the bill?
I second it. Gotta start somewhere, guys. We're way behind.
We have a motion and a second.
Doesn't mean jump
Any
off
other
the cliff.
discussion?
They've already jumped.
I know. Any other comments
It's
from the
already
public?
jumped.
Thank you again. As a lawyer, it pains me to hear such seasoned experts talk about the distinction between discussion and recommendation. Lawyers could spend 6 weeks trying to figure out what that means and craft it however they want. The only message I have is please lead now. The market calculations are enormous, and the market abhors a vacuum. We need veterinary leadership, even if it's a baby step. I support Dr. Sullivan's position. I hope the board gives this very important thought because the commercial aspects are watching this very carefully. And if this doesn't come up again on an agenda item for 6 months, 6 weeks, the landscape's going to be entirely different, and this room will look very different. Thank you.
Dr. Sullivan?
I am not making this motion to appease or address the market. That is not where I'm coming from, and it should not be the board's decision on making this.
Okay.
Explain why you're making it.
Jennifer.
No,
Jennifer?
don't.
All right,
I just want to be very clear what we're voting on because we have a novel of paperwork we've been handed.
Yes.
Yes,
The CBN, okay.
yes.
So, and it's as written.
Yes.
Just a couple last comments. I just would urge you to, again, read what we've written. And again, we're not encouraging to recommend the use. This says to recommend if medically appropriate within the veterinarian client-patient relationship. And it involves guidelines written by this board to direct veterinarians with the best practices possible.
That's
This is
beautiful.
not promoting negligence by a veterinarian, so I just wanted to make that clear.
Thank you. That's good. Good information.
You want to talk? You want to say anything?
My concerns are how is the Veterinary Medical Board going to write guidelines on the use of cannabis?
don't have-
Because the UC Davis people are gonna get their research done by the time we would get around to it.
Next
It
week.
won't be.
Come on, let's be serious.
Get on it.
Okay, call for the vote.
Dr. Waterhouse.
No.
Dr. Sullivan.
Yes.
Dr. Nunez.
Yes.
Jennifer Laredo.
Yes.
Kathy Bowler.
No.
Judy Mancuso.
Yes.
1, 2, 3, 4. We got 4 yeses, 2 nos. Yeah.
So you have 6 members, I
Yeah.
believe it requires 5.
Oh, it does?
Requires 5.
Oh. It doesn't go anywhere. It requires 5 members because there's 6 present to vote to pass it.
Can
Why
I
does it
make
require
a
5? I'm
substitute
sorry.
to
We have
watch
another
it with,
Because the-
can I make a substitute to watch this bill 215
Another vote too?
Yes.
with
Oh.
continued work with the author?
Yes, you may make a
So we have an
motion.
active watch position in terms of, and work with the author on language for the full bill.
I'll second.
Okay, we have a motion and a second. Any other?
I didn't hear the
Okay, so the motion,
distraught over what I just about that whole thing with the board and the
5 people. Say again,
Okay,
please.
listen.
It was to watch this bill right now, but immediately start to work with the author.
So
On
watch
its
it.
To do what?
Actively work with the
Well,
author.
Just to work with the author to see what it's gonna end up, to work with it. And this is not the bill, this is just one piece of language of a bill that we don't know and have, is my point. So,
Okay, we have a motion and a second. Any other discussion from the public?
Be careful.
I haven't had any cannabis.
Although maybe you should.
A quorum, 5 members of the board constitute a quorum for a transaction of business at any meeting of the board. There are 6
Yes, but
members
there's-
present.
There's other language that says that with 6 members, there has to be 5 for
You
affirmative.
have to have a majority.
That's a Robert's rule.
Yeah. It's in the
It's-
board administrative manual. Tara can read it.
Right, page 7, the citation is B&P Code Section 4807, that's to the side, supporting the following.
Let's vote.
5 members of the board constitute a quorum for transaction of business at any meeting of the board. At a meeting duly held at which a quorum of 5 members is present, a concurrence of 3 members of the board present shall be necessary to constitute an act or decision of the board. When 6 or more members of the board are present at a meeting duly held, the concurrence of 5 members is necessary to constitute an act or decision of the board.
So would that
Okay.
change anyone's vote?
No, we're
Okay.
No, because I just,
yeah.
Okay.
So we have a motion and a second.
Who's the second?
Jennifer?
Dr. Waterhouse?
Yes.
Dr. Sullivan?
No.
Dr. Nunez?
Yes.
Jennifer Laredo?
Yes.
Kathy Bowler?
Yes.
And Judy Mancuso?
No.
Oh my God, Judy.
It's like we gotta lead this watch stuff.
We are.
I'm sorry. No, no, we're not. No, we're not. No, we're not.
So it carries.
No,
We
it's
need
4.
5. That's
Same
right.
thing. Same thing.
Okay, well, we're back where we started. 4-2.
so we have nothing. We're gonna do nothing.
Are we done?
Yeah, it is.
We are done with this topic.
Unless somebody can come up with another motion.
I think we've covered the motions.
No,
Is there
I have another motion.
Okay,
I say that we vote to support, let's see, with, well, recommend you said was only, what got everybody so bad here? The recommend?
recommend. Take out the
That was
recommend.
one piece of it, it was just the confusing, the verbiage, which meant that there needed to be a little bit more work done.
All right, how about if we vote to support the language 2215 and change the word recommend to discuss and help evaluate? How about if it's something more that we don't want to get them in trouble with their license. We don't want them to recommend because we haven't done our due diligence with the university work. But we want to be able to talk and do something, for God's sakes, and lead.
We also have, Anne Marie wants to make a point.
Okay, go ahead.
So there is some concern about the language requiring the board to come up with guidelines on use of marijuana, which I think may be troubling because I think we're gonna.
So then we could
end up with
strike
this
the
ridiculous-
guidelines. Okay, so strike that the board comes up with guidelines because we're not ready for that until the university has done their work.
Again, I think the board could communicate to Calra's office that we'd like to see legislation done so that veterinarians can discuss the use of marijuana with their patients. However, our concerns are as follows. We're concerned about recommendation being an endorsement. We're concerned about having a lack of disciplinary oversight. And we're also concerned about creating guidelines when we don't have any evidence-based practice to rely on.
Okay, that's my motion.
Okay, we have a motion. Is there a second?
Is the motion to do what Anne Marie just said?
Yes.
Then I'll second.
But was it,
Second.
what is the initial?
Val. Val's like,
Just to communicate, send a message to Calra's office.
The whole reason that the word recommend was there is because it's existing language that allows physicians to discuss it at that level to their clients. It's an important word in the bill, and and we're following that model because that gives us the example of an existing legislation that passed.
Well,
Can I just
Dogs are not
clarify?
people.
yeah, go ahead.
That language is in the Uniform Controlled Substances Act. It is not in, it didn't start with the Medical Practice Act, and that's what this does, which is, should be a concern because perhaps this board doesn't enforce a discussion, but if you're doing anything else in violation of the Uniform Controlled Substances Act, this Medical Practice Act doesn't affect that, or who enforces the Uniform Controlled Substances Act and the DEA registration.
Dr. Sullivan.
You know,
We can't just
the facts are that we have the ability to prescribe a hell of a lot stronger drugs than marijuana.
Exactly.
And it is not being abused.
Right.
And I'm having trouble with this argument of abuse. My responsibility to my clients is not to experiment on drugs. If I'm going to prescribe a drug I have not used before, whether it's any drug, I have to have background research material that I can justify it. My intent of using the word recommend is so that those out there that are doing research, and I'm not talking about general practitioners, I'm talking about specialists, have an avenue to do some basic research if they want to, so that we get the information to us. That doesn't preclude getting funding for doing double-blind studies and doing it the right way. My only reason for including the recommend has to do with starting basic research with specialists, and that was where I'm coming from. But if there isn't documented cases that a practitioner can use to back up his case, he's got no case and he shouldn't be using it, period.
But this language doesn't talk about just specialists being able to, do their own case-based studies.
It does not, but it allows them to do it.
I agree with UC Davis that we should do this the right way. That just because we're getting pressured from certain people and we're getting pressured from clients to say we need to do this, we still need to do it the right way.
I agree you need to do it the right way, but there's some low-hanging fruit. Like my cyproheptadine mirtazapine thing is a perfect example. I mean, that you're not going to kill the pet, you're going to help the pet.
There are dogs that have died from marijuana.
Well, yeah, the wrong dose.
Oh, again. Yes, there are dogs that have died.
Could we have
from
Anne Marie
marijuana.
reread the questions? What the communication?
Yes, so we have a,
Just so
we have a
because I
motion.
might be for that.
I think we have a motion and a
we have
second.
a motion and a second.
And that motion was, it was not a support or opposed position. It was to work with the author's office to at least identify the concerns that have been expressed here today. One would be using the term recommendation. The other would be the board developing guidelines on the use of cannabis, and also the board's lack of disciplinary oversight if someone is abusing the use of cannabis. And those are the concerns that
And
I'm
Was
hearing
one of the concern in the development of guidelines was how do we go about doing that
without research.
professionally without a body of research? Those were questions
Yes.
for the author. And we weren't talking about
There's public
funding
comment.
research.
Okay, Dr. Sullivan.
The guidelines that I have seen, and I didn't read them really thoroughly, but I did see the medical guidelines, and they're not based on research as much as they're based on, you have to document the need for the case, you have to you have a plan, a progression and plan, and you have to follow up, and if the patient is not following improvement on that plan, then you have to discontinue the treatment. I mean, it's a protocol, as I read it, recommendations, and what it gets away from is for a physician just giving a recommendation or giving a card and then not having any contact with the client again.
Right.
So that's the
That
type of
sounds good.
guidelines that I saw from the medical board.
Which again, dogs are not people, but do you have a comment from the public?
Dr.
Thank you again for indulging me. It hasn't been mentioned today, while I would love to see the formal strictures of research as veterinarians are desirous of and used to in evaluating efficacy and safety, not a word has been mentioned about the federal government's position on this particular product. Cannabis is Schedule 1, as we all know. The current administration is doing everything in its power. As a lawyer, I look at this daily and weekly to prevent actual research. I think the doctor from UC Davis has given a very good effort 2 years into it, and the waiting list is 2 years. So if the VMB is saying we have to do this the right way and we have to have the research, they will not be leaders, because an organization outside of our control in the state of California is going to prevent that. They're preventing it on the human level, and they won't even think about animals for another 10 years if they're in power. So it's an illusory argument to the public to say we have to wait to follow our approved path, but the main barrier to that path is the federal government. California should lead. Californian vets should be the #1 leaders in this space. If they don't, the state of Oregon or other states will do so.
Okay, thank you.
Grant Miller, CVMA. So we discussed this topic of research quite extensively, and I would just like to call to question the notion that there is not research available for the use of cannabidiol or other cannabinoids in dogs. At our House of Delegates meeting that we discussed this, there were a number of veterinarians that came up citing peer-reviewed research, and I just searched PubMed, which, there's research, then there's research, and we as the veterinarians know where we really go to find the real research, the peer-reviewed research. So here it is, just an example: Pharmacokinetics of Cannabidiol in Dogs, Journal of Drug Metabolism and Disposition, May 1988. And the peer review board for this actually has faculty members from UC Davis on it. So I wouldn't just leap to that conclusion that there is no research out there. I think that there is credible research out there, and I think it's up to the veterinarians who choose to make recommendations, if that were to come to pass, to find the research to be able to justify their decision. Some veterinarians may not. I might say, hey, this isn't my bag. I don't know this type of medicine. It's no different than any other medicine that we use. There might be things for species that I don't work on that I would say, I'm not qualified to tell you about this, whereas there's another doctor who maybe has 20 years of experience in it and who knows about the research that's out there. So I think it's out there. I think that the board has an opportunity to look into that a little bit, and hopefully that will be considered as you go forward. Thank you.
Dr. Payton.
Hold on, Kathy has a question.
Well, I was going to
for-
ask Dr. Grant. No, Grant.
I do appreciate his comments, but that peer-reviewed study is the one that I mentioned. So I got the year wrong.
88.
I will admit it wasn't 84; it was 88. Oops. But that is the only study, and that was done in dogs. Not very many dogs, and the doses that they used were actually not doses that people are currently trying with their pets. They were very large doses, and then there was a smaller dose. And so those were also research dogs. They were not client dogs, they were research. So it was an important study. I'm not knocking that, but my comment that there wasn't much research is really applies to appropriate doses for these animals. And so, I do appreciate bringing that paper, and that was the one that I mentioned earlier, because I've done a lot of, and I will mention that, we talk about the recommendations from medical doctors, but one of the things is I attended the Harvard Medical Cannabis Conference last year. So, obviously I'm very pro and interested in this area of science. But the research is moving forward. We're having trouble with the federal government, but they just published 3 studies on the FDA, which they're trying to approve the Epilex, which is a whole nother world of issues, not talking about the products we're talking about today. But that is moving forward. But a lot of the MDs, we are trying to establish these, blinded, random controlled studies that Dr. Johnson mentioned. And we need to do the same for veterinary medicine. We actually do not have them. They do not exist in peer reviewed. So I disagree with that particular comment. So.
I was just going to say, you're talking about yourself as a vet, blah, 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 blah. Doesn't it put you in a kind of a tough position, a vet, to know that if you say you just don't know that much, that they're going to leave you and go to another vet? Is that any kind of an ethical problem on something like this, or will it make vets really try to study and learn as much as they can by, going online and reading as much as they can in order to be able to talk to their patients about it, or their clients, I should say?
Well, it's a good question. For me personally, I don't have a problem. I mean, one of the best things I've learned as a veterinarian is to be able to say, I don't know. Mm-hmm. And there are areas of medicine, I don't know anything about neurosurgery in dogs. Yeah. Now, put me into a horse's mouth and there's not many people that are going to tell me what to do. So this area essentially would be no different. I mean, there are things that we try in veterinary medicine that don't necessarily have peer-reviewed science behind them. There are things that we use every day, all of us in the medicine that we use, that are really largely anecdotal or clinical by our own experience that we try. So right now, I'm using acyclovir cream to treat sarcoids. Who knew? Acyclovir is an antiviral. Sarcoids are cancer. Who knew? But it works. And is there peer-reviewed double-blind placebo? No, there's not. And my patients don't have time to wait for that. I use it in them and it works in them. And that recommendation came from UC Davis, from one of the surgeons there. So there's all sorts of things that we try every day that aren't necessarily having this beautiful, slope and run of research behind them. We have to move as quickly as we can on some of the medicine. So it doesn't really bother me much. It puts me in the same position that I'd be in with any other drug that I choose to use. So among my patients, I have to make the decision based on my knowledge, and I have to be ready to defend that to the board if it came to pass.
No, and I guess I'll comment. I completely agree with that. I mean, there's definitely something to our clinical knowledge and what we know, and that's why I'm so interested in finding out more about cannabis use for animals. But the role of medical cannabis right now is a very different controversial position than acyclovir. That's my only issue, is that I fear that if I was in private practice for over 8 years, so I definitely can appreciate, and I still practice, so I do see it applicable, but we also need to make sure we take the right road and we get the information that we need to do it correctly, especially on this topic, and that's kind of where we're coming from, or I'm coming from, I guess.
Dr. Miller, can you speak a little bit more on the guidelines that Dr. Sullivan was discussing? I think when we first thought of guidelines, we're thinking of very detailed, but more or less what you're talking about is protocol more than anything else. Could you talk about these guidelines in 2215? What would you expect from us to deliver on that?
I can't speak to that, Judy. I'm not qualified
Okay.
to speak to that. I don't know if Val can. And keep in mind, this is the author's bill.
Okay.
We have communicated with the author, but it's not.
Because I think that if it's about protocol and you try the smallest dose, okay, well, I have a motion. And right, okay. Okay.
Okay, so there was a motion and a second.
I did think my motion was going to be to support it, but when you read it back, you said it does not support or oppose.
Right. So the motion and the second were from Bowler and Laredo to essentially work with the author's office and express our concerns regarding the recommendation piece without the research, perhaps getting further information about the expectation of these guidelines and the disciplinary piece that Bonnie alluded to that I have an issue with where, it ties the board's hands if someone is abusing the use of cannabis with pets.
So I made that motion and someone
No,
second?
No, Kathy Bowler made the motion.
Kathy made the motion and Jennifer
Laredo
second.
seconded.
Okay.
All right.
Call for the vote?
Dr. Waterhouse?
Yes.
Dr. Sullivan?
Yes.
Dr. Nunez?
Yes.
Jennifer Laredo?
Yes.
Kathy Bowler? Judy Mancuso?
Yes.
Motion carries.
Finally, thank you. And we're going to take a bathroom break.
Sounds good.
5 minutes.
5 minutes.
Okay, dinky dink.
Sorry, put my microphone on. We are going to move topics, agenda items number 8 and 9 until tomorrow. We are going to go ahead and finish the legislative materials today and then try and, I guess, is there someone here that wants to talk about the corporate practice? I've heard there was, and if there is, then we'll go ahead, we'll talk about that today. Okay, so let's finish the legislative. So we are on 11D. Anne Marie.
So, Val, do you want to come up and talk about declared emergencies? You want to probably run at this point.
This should be easier.
Yeah, much
We
easier.
hope.
So, I'm sorry. We have a proposal in your packet. This is not yet in a bill, but CVMA is working on getting an author for this bill. This is something that the board expressed interest in at the last meeting to work with CVMA to get something in the statute to cover a veterinarian who's responding to an emergency and what they can do in response to, or what they can do for the client and the patient animal during a time of a declared emergency. Thank you.
So this, just to refresh your memory very quickly, this is from the Northern California fires at the end of last year, where veterinarians were in a situation of great need to move a lot of animals very quickly who had been displaced in the fires or were with their owners who had been displaced in the fires, or the veterinary practices the owners had been to could not operate because of no electricity or damage or had burned down. And they were in a situation where they had a lot of animals and wanted to know if they could bypass the VCPR in order to just give out medications that were not available because of the fire. And we worked with Anne Marie at the time, and she worked with Tara, and they just couldn't find a section of the code that really worked very well to bypass the regulations or the law. And there are there's both pharmacy law and medicine that give some ability for boards to give some leeway here. So we worked with Anne Marie and came up with this language, and as you can see, it's very specific. It's within a 25-mile radius, and it is pretty compact as to what could be allowed or what the board could allow during a declared disaster.
Thank you. Kathy's not back yet. Neither is Judy.
We don't have a quorum. We're losing people.
Yeah.
Can I vote?
Okay.
No, we don't have enough for a vote.
We don't.
Do we
We
have
can
anyone?
talk.
We can talk
We can
about it.
talk. So any questions?
I have questions.
Okay. Val?
Yeah.
Val?
Val, Tara
have
has
questions.
questions.
Yes.
Tara, Val's ready for you.
The way I understood this initially was practitioners were concerned about providing emergency care and medications without having established an appropriate level of VCPR.
Correct.
Because you can't run the diagnostics and get lab results and all that to make sure that whatever treatment is appropriate, you're just doing triage. With that in mind, this language appears more to, it looks more like civil liability immunity than it does an exemption from the requirement to establish the veterinary client-patient relationship, which to me might be more appropriate under the regulation for that. So the way it would look is VCPR is required to be established, except for situations of emergency care for, and here's my other question, what emergencies are we talking about? What we experienced was a declared state of emergency recently with the fires. This language is raises issues as to what is an emergency impact zone. What kind of emergency is that? How is that different from other emergency care that is already provided for? I mean, if we're talking about making practitioners able to provide care with outside of the scope of what they're normally required to do, then we need to do a better job here of limiting the scope of the availability of this exemption. So I'm saying, when I look at the Medical Practice Act, I see a more of a limited exemption aimed at states of emergency or some other local disaster, rather than just an emergency impact zone. I don't know what that is. So perhaps it could be better defined somehow.
Yes, Dr. Miller is our disaster expert, so I will ask him to come up and define it for you.
Well, speaking of disasters, today's meeting is a good example. So I'm the state coordinator for the California Veterinary Medical Reserve Corps, and we are very closely tied in with the California Emergency Medical Services Authority and the California Office of Emergency Services. And those terms, Tara, are the exact terms that are used in reference to the types of emergencies that you're talking about. So there are three types of emergencies. There's a federally declared emergency, which means President Trump and only President Trump can declare an emergency. There's a gubernatorial proclaimed emergency, which is it's the state of California, only Jerry Brown can do that. And then there is a local, it's not proclaimed, it's not declared, it's whatever's in there. The language is specific, and it's specific to the legal connotation of the emergency. Impact zone is part of the Emergency Services Act. It pertains to the area that is declared to be in the state of emergency.
Right, but perhaps we could do some kind of cross-reference so that we're all clear that this is a declared emergency, not just
so pursuant to
what the veterinarian or RVT or someone else, and question mark on whether an RVT is covered under this, which potentially they should be, because under the emergency services statutes, it's a veterinarian or RVT is exempt from civil liability in declared states of emergency when providing care at the direction of a state or local official. Because obviously the veterinarian, the point is to provide the exemption from establishing all the criteria for the VCPR. But, aren't we also talking about RVTs, rendering triage aid as well? I don't know, I'm just bringing that up for thought, but the state of emergency statutes provide direction. You know, they talk more about, you know, what qualifies and why it's necessary to eliminate responsibility and enforcement in certain cases. So I would suggest if we're just going to use local or some kind of emergency impact zone, that it at least have a cross-reference to whatever statute you're referring to. Because otherwise, I'm looking at the pharmacy code, and it has this exemption where you can provide prescriptions in a declared emergency. And it, you know, declared is, that's the qualifier there, that this language is missing.
So we are totally open to your input. This is a collaborative effort. I think we all want the same thing. So if we're getting stuck on any language, we're happy to work with you, and if you have suggestions and we can make it better. I don't feel like we have to go through every word today because we're short on time, but
Yeah.
we'll be at any meeting you want us to be at, and we're available at all times. We would like to get something through this year because it was a big problem, and we would like to get it fixed. And whatever you guys think works, we'll work with you.
This is a result of like the Sonoma fires and, yeah, specifically and the other fires because of the vet clinics that were in the danger zone and the ones that weren't. And
I mean, some
there was no
disasters are all
way.
different. And-
Yeah, it was crazy.
Right.
I know
And an
for
earthquake
myself.
could be the same.
Yes,
happens
exactly.
in an instant. So
And
what we're looking for is something more specific to handle, those types of disasters, but you never know what any day can bring.
Yeah, because I was wondering about the delay in calling, declaring an emergency. I mean, they do it fairly quickly, but that could be 24 hours. It could be whatever, and there's still a lot of time in between.
So just to respond, we have the government code section, which we're all aware of, 8659, but for those that aren't, it does talk about the types of emergencies, render services during any, and the subdivision A talks about physicians and surgeons, pharmacists, respiratory care practitioners, nurses, dentists, and then B is veterinarians and veterinary technicians who render services during any state of war emergency, a state of emergency, or a local emergency. The problem with this language, why it has not been particularly helpful, is it says it has to be at the implied or expressed request of a responsible state or local official. And to your point, Kathy, during the last episode, the last fire, that's why we couldn't just allow veterinarians to go treat, because we didn't have an express or implied request of a local or state officials. It just needed to happen, and it needed to happen at that point in time.
Which worries me.
Right. So I do think this is intended to go a little beyond the government code section. I think if you wanted to reference what type of emergency that we're talking about, not just because someone said, hey, it was an emergency situation because I deem it to be that, that's not what this is intended to cover, which we know that. Perhaps we can cross-reference the government code section, but I also, to Tara's question about whether or not this is supposed to be including an RVT wouldn't be establishing a VCPR or wouldn't be able to treat without a veterinarian present. So, and Dr. Miller, answer the question as to whether when you're deploying the emergency response protocol and you're deploying your team, are there RVTs on your team as well, or is this strictly veterinarians?
There are RVTs and veterinary assistants, but this bill does not pertain to the Medical Reserve Corps.
Okay.
The Medical Reserve Corps deploys under the California Emergency Medical Services Authority, and so we are vested.
Right.
We have separate. This is about the hospitals in the periphery where people, anyone, just decides to walk into the hospital and they say, my dog's on phenobarbital, or don't use that one. My dog's on
heart medication.
Rimadyl.
Heart medication.
Heart medication, and it burned in the fire.
Yeah.
Could I get some more?
Mm-hmm.
So that's what we're talking about
That was-
here, and those are good points, Tara. We actually at one point did research that language. Emery, what was that government code section? Is it 8659?
Yeah, it's government code section 8659. And it's where the authority is vested now for veterinarians to respond to declared emergencies. I think that would be a great cross-reference. But I also agree that that doesn't do enough because there was a need and we were out on a limb trying to give veterinarians permission, if you will, to treat these animals, which was absolutely necessary. So for the public welfare, the animal welfare, I think the Veterinary Medical Board should be continuing to work with you to try to make this fit those situations.
I've also got another idea of tightening the language on when they can describe and prescribe a dangerous drug, which is to model the, once again, Uniform Controlled Substances Act. So what I'm recommending is to strike to further the health and welfare of the animal patient, which is pretty broad, to instead follow the guideline of the UCSA to instead read where failure to provide services and/or medications, including controlled substances, may result in loss of life or intense suffering. Just to pull all the statutes together so that there's no concern anywhere. You followed the dangerous drug requirements under an emergency, things of that nature. And then I would also, this last sentence, the veterinarian shall make an appropriate record, including the basis for proceeding under this section. That should be its own paragraph, because that should apply to the initial dispensing or prescribing, as well as refilling a prescription where it's currently sitting. But yeah, I think in concept, this is a really important idea. Because clearly we've had some major fire disasters, and we're going to have more.
So we'll go ahead and look and make those changes, and then we can shoot it back over to you and see if that's acceptable.
Vote on the concept?
I think we can take a vote on this concept because I think the board was in agreement to support this moving forward, this legislative session, and I think that would be an appropriate move at this point.
Motion to support.
Second.
We have a motion and a second. Any other questions from the board?
Well, since I walked in late, what's the bill number again?
There's not a bill number yet, it's conceptual.
Oh.
And it's,
Do we have an author?
It's regulatory.
Oh, okay.
Any other questions, comments from the public? Call for the vote?
Dr. Waterhouse?
Yes.
Dr. Sullivan?
Yes.
Dr. Nunez?
Yes.
Kathy Bowler?
Yes.
Jennifer Laredo?
Yes.
What about me?
Oh my gosh, Judy Mancuso? I'm
Hello.
so sorry.
Been here all day.
Well, you weren't actually when you were out.
Oh, yeah,
during
when
this
I used the
discussion.
restroom.
Sorry.
Okay,
Judy
yes.
Mancuso, I'm sorry.
Yes.
That was not intentional.
Just for you.
Okay, moving on to 11E, legislative proposal regarding the status of the premises permit following disciplinary action against the licensee manager and premises permit application requirements for owner and licensee manager. And Anne Marie and Tara are both gonna speak on this one.
Okay, so this one, I'm not completely confident that we're ready. Just my own personal feeling for an actual vote, but I do think the board needs to at least understand, and this will become more clear in some of the cases you see tomorrow. The current problem we have with the premises permit registration is that it is unclear who the applicant is. So the managing licensee has the license and therefore has to be on the application. The board has to do a background to make sure that person doesn't have any disciplinary action or any other reasons that would prevent that managing licensee from serving in the oversight capacity of the actual premises. However, it doesn't give the board any authority to do any background on the premises owner. And what we've seen most recently is that we have been in situations where we've revoked the license of a veterinarian, and now they're an unlicensed person. They turn around and they buy a practice, and I don't have the authority to deny necessarily that premises permit, even though that owner now has potential influence and control and decisions over how that practice is being run. There is an additional, do you want to speak to the applicant part?
Yeah, I just had a clarification. Right now, it's easy to identify when the licensee manager has a problem. But what the premises permit application asks for is the applicant.
Right.
And we don't know who that is.
Right.
So the idea is to get clarification that that application for a premises permit would have to include the information for both the owner and the licensee manager, not just the quote applicant, whoever that is.
So that's the first prong. The second prong has to do with when we revoke a premises permit. Current language under 4853.6 says when the board the board shall withhold, suspend, or revoke a registration of a veterinary premises when the licensing manager essentially has been revoked and there's no substitution for that licensing manager during that period of time. So what has been happening in some of our enforcement cases is we have an MGL that the board is seeking revocation on, and so we essentially need to revoke the premises permit with the revocation of that MGL if in fact the cause of action or the reasons for discipline have to do with minimum standards, right? The facility was unsanitary, there was unlicensed practice occurring out of the facility, things that MGL would have been responsible for. So what's currently happening is during those proceedings, we're getting applications to essentially switch out the MGL so then it preserves the premises permit and we don't get to revoke the premises permit. However, the board has we have no information as to whether the issues that led to the revocation of the MGL and the premises permit have been rectified. And now we've got a facility that's trying to continue to practice under this cloud of enforcement. And there's not a lot we can do about it when it says there's been a substitution. Now, the practical process that occurs in the office is if you switch owners, it's a brand new premises permit. So you have to file for a new premises permit. It's an application. You go through the process. If you are just switching licensing managers, they just have to send in a form that says, this one's out, this one's in.
So there's no background check of the new.
Oh, yeah, of the new
license manager.
MGL, but
Oh,
what the board
okay.
won't know is, are the same issues that led to the revocation of that MGL and the facility still at issue? And that's what we want to prevent. So I think there's a way to bridge this language so it says that maybe prior to a substitution for the responsible licensing manager being made, the board has to conduct an inspection and assure that the facility has adequately rectified the issues that led to the discipline. Something of that nature, because right now there's no protection. So the way it reads now, it just says, regardless if he or she is subsequently removed and replaced as a licensing manager. Well, that may be too restrictive, because now what we're saying is there's other vets that work in this practice, there's a whole community being served by this practice, and we're saying we don't care if you've substituted a licensing manager, we're going to revoke your premises permit. So I think there needs to be a middle ground.
Yes, Dr. Sullivan.
If the practice was being disciplined, wouldn't the conditions of getting the premises permit back be dictated in the condition of the probation or the disciplinary wording?
So see, that's what's happening is when we discipline the MGL, who's responsible for that site, we discipline the permit, because that's how the language reads.
Right.
That permit is tied to that MGL. So what they're doing is they're requesting to substitute a new MGL to remove the discipline of the practice and just solely focus on the individual.
But if the complaint is unsanitary conditions, wouldn't the disciplinary or the decision on the disciplinary wording say that you can't? I mean, can't that be part of the discipline? You can't continue operations until you have an inspection?
If we change the statute, because right now what's happening is the discipline because they're removing the person that's being disciplined, the licensing manager, and they're replacing it with someone else. The argument from opposing counsel is that discipline should no longer apply to this facility because we've removed the problem, that being the MGO.
Okay. Can't we then word it that way, as if, if there is a disciplinary action on the physical building, then
An inspection would have to be
Yeah.
done before there'd be any approval of a change of
Yeah.
MGO.
so what, does this allow us to do it, or we need to make language change?
So this would be my recommendation where it says, when a licensing manager, basically when there is a request for a substitution of the responsible licensing manager is made, or however you want to say that, by application, as provided for in section 4853, the board shall conduct an inspection of the premises to ensure that all minimum standards have been met.
I'm fine with that if, if that inspection can be done promptly.
Right.
Yeah.
Right,
I mean, because sometimes they don't
Right.
get out there for
right.
2 or
Well,
3 weeks.
I think what will help is changing the application so changing it internally, the procedure being, if there is a substitution for a licensing manager, it should require an application, because that gives the board staff time to say, okay, we need to look at this because there's been a change in the oversight licensee. Within that time frame, while we're evaluating that application, we send out an inspector.
Yeah, the problem I have with that is if a licensing manager gets ill or dies, or, I mean, something serious, there's got to be a method of getting somebody in there quickly to stay open.
And what you could do then is say, for the purposes of a disciplinary action,
Yeah.
and limit it to a disciplinary
There you go.
action.
That works.
Yeah.
Okay.
That would be great.
Yeah.
Can you guys delegate to board council to work on this language to capture what we just discussed? This would go into a committee bill as one of the board's proposals. We have several others that have already been approved. I have preliminarily talked to the committee about this issue, so they are aware of it, but I said the board had not had a chance to look at it or vote on it. And I was concerned with the language that we'd put forth to you because it is far too restrictive. But I do think there is room in here where we could work on, for the purposes of a pending disciplinary action.
Yeah.
Okay.
I so move.
Second.
Any other questions, comments?
Who seconded that?
Judy.
Yeah,
Thank you.
I did.
Okay.
Any comments from the public? Well, thank goodness.
Yeah.
Call for the vote.
I'm going to start with Judy.
Yes.
Mancuso?
Yes, I'm here and I vote yes.
Dr. Nunez?
Yes.
Dr. Sullivan?
Yes.
Dr. Waterhouse?
Yes.
Jennifer Laredo?
Yes.
Kathy Bowler? Okay, next item that is on the board's agenda is a legislative proposal for spay and neuter surgeries as continuing education credits. And this has been sponsored by the ASPCA, and we have someone here to talk about the bill.
Good evening. I feel your pain, so I'll be very brief. This is a bill sponsored or authored by Assemblymember Brian Mainshine, and his staff was hoping to be here with me today, and apologizes that they weren't able to make it. With the beginning of the session, everybody's super busy over there, as you guys probably know. So the bill really stems from some work that we've been doing on the East Coast. Both New York and New Jersey have passed similar laws, not necessarily focused on low-income communities, but our focus is really based upon some of our work in LA and seeing, as was referenced earlier, seeing the dearth of veterinary services in low-income communities, and in particular in LA County, where there are mandatory spay-neuter laws, where we're seeing coming into the county shelters just large numbers of animals being relinquished by their families because they can't afford to correct the violations associated with the mandatory spay-neuter laws. So, really the way we perceive this bill is really just a win-win-win-win all the way around. It's a great opportunity for educational attainment for veterinarians that don't regularly provide alteration surgeries in their normal daily practice. Shelter medicine is really has to be, from a financial perspective, on the cutting edge of cost effectiveness and really utilizing the most kind of up-to-date means for doing spay and neuter surgeries. And so it's a great opportunity to kind of refresh those skills if you're not normally using them in your practice. At the same time, for veterinarians that are working in surrounding communities, it's a great way to build goodwill in the community with, your local elected officials, your public officials, and really just kind of to be a part of a community. Obviously, I don't have to tell you guys, the importance, in the animal population and the burden the shelters and the rescue organizations on unchecked animal, breeding. And so, certainly from that perspective, it's an important aspect. And so essentially what this bill would do is to take your existing continuing education structure, 36 hours every 2 years. There's a segment in there, as you guys well know, 6 hours for self-study. This would expand the options within that 6-hour bucket to allow voluntarily, obviously in the choosing of each licensee, the ability to fulfill those 6 hours if they chose to do the self-study bucket by doing pro bono services that benefit low-income communities, specifically providing spay and neuter services in conjunction with a public shelter, private shelter, rescue organization. So that's the essence of the bill in a nutshell.
Jennifer.
I had a couple questions on it. I like the concept of it. My question, would there be a minimum requirement on how many surgeries would have to be performed? Is it 1 per year to fulfill the 6 hours? Is it however long the surgery takes?
So it's up to 6 hours, 6 hours of active participation. And so, whatever the time frame is, depending on the practices of whatever rescue organization that they're, working with or public shelter they're working with, it'd be, essentially within their procedures. So no specific.
You're saying 6 hours of surgery?
Of surgery.
Should be
so,
surgery.
but not any number of surgeries within that
Okay.
6 hour period.
And then also, would there be any criteria? Would it be income, proof of income or anything like that? Would the veterinarian be able to just perform surgery on one of his clients that would come in anyway? Would it be shelter animals?
So there's a definition in here, and I was actually just looking at this during one of your prior conversations. So we may need to modify that slightly, but under current law right now, the federal government designates through its Community Development Block Grant Program specific communities that are CDBG eligible, which are defined under law as being communities where the median income is at or below 80% of the area median income. And so if an existing client came from a community that was CDBG eligible, then they would be eligible to get that credit for that purpose, but in conjunction with, it wouldn't just be in their private practice, it would be in conjunction with a shelter or a nonprofit rescue.
Okay, thank you.
Judy.
I don't think you stated your name in for the record when you sat down.
Sorry.
I'm sorry. I was very focused on the author. My name is Susan Riggs, and I'm with the ASPCA.
So Susan, I have done extensive research, and I'm a huge proponent of spay and neuter, but the fact that this states that, and you just stated it, that people are just relinquishing their animals because of spay and neuter laws, I can't find any truth to this. And I am all for spay and neuter. I'm all for free spay and neuter. I'm all for ASPCA spending their hundreds of millions of dollars to fund spay and neuter. But I really take issue with this because I've heard this. It's a myth. We've gone out to shelter directors everywhere saying, do people relinquish their pets because of spay and neuter laws? And the answer is no. Number one, they relinquish their pets because of impound fees, number one. And if there's ever an issue with spay and neuter, the shelters will bend over backwards to make sure that they help them and give them payment methods or free or find a voucher or some way to get that spay and neuter. So
But we're kind of off topic.
I know, but
We're off
I mean,
topic.
I'm
We're off the
looking at
agenda.
what's in front of me and, this is just wrong. And
Okay.
I'm okay with the idea of spay and neuter. However, we have a lot of continuing education needs for veterinarians.
Yeah, we do.
And so
Dr. Nunez?
I really value continuing education as a component of protecting the consumer because medicine is always changing and we absolutely have to have those continuing education hours. And I don't think that that doing pro bono work, doing spay and neuters is an adequate replacement for that. I don't really believe the argument also that you'll learn new techniques on how to spay and neuter. It really doesn't change much. It pretty much has stayed the same. But to address that point, perhaps one thought might be, I know that in the judicial system, people are given community service as a punishment, but in some of our disciplinary cases, perhaps we can use community service as a form of discipline. Of course, not the ones that have been disciplined for surgery. It might not be appropriate for those, but that might be an avenue that we can help out with the issue.
I agree, if it was appropriate.
But I don't want to see that replace continuing education hours. I think I value that too much.
Well, again, it's 6 out of 36 every 2 years, up to, and it's a voluntary, it could be 0.
Some people really need those extra 6.
I guess as an attorney that has to complete my CLE, there are some self-study alternatives there, and I would argue that, that's not necessarily the most valuable time. I mean, I think certainly active, going to conference, workshops, that sort of thing. So I would argue that this is probably pretty equivalent to your self-study option right now. If you don't believe that there is any educational value in performing surgeries in a different context.
Kathy?
That was what Mark was talking was something I was going to ask as a non-vet here. On the self-study block, the 6 hours that we're talking about taking away, what types of, because I believe in continuing education too, and there's a lot of elements and components to it, from ethics to pharmacology and everything else. But what is the self-study? What would someone be losing out on opportunity-wise to learn, or is there any way to quantify that?
You don't have to do self-study for that 6. It's just that you can do up to
Right.
6 hours of self-study.
And use that and apply
but
it
there are
to
some, I think Anne Marie was saying there are some other things that will count as self-study other than reading articles.
So I had staff do some research on what other boards do with regard to giving CE credit for things that are outside a typical classroom environment. And some of those things include participating as an exam expert for exam validation. In our case, we give self-study to our hospital inspectors, or we give CE credit to our hospital inspectors for going through hospital inspection training. There is CE sometimes awarded for completing surveys, whether they're occupational validation or occupational analysis surveys. So those are areas where other boards have awarded CE for things other than the typical classroom approach. I did not, however, find that there were any boards within the Department of Consumer Affairs that awarded CE for pro bono work. That's not something that we have as an example here in DCA. So that wasn't one of the areas. However, I know that in some of the other health professions, if a licensee agrees to work in a underserved community or underserved population, there are some licensing exemptions, if you will. They can operate under a temporary license at times if they're providing community service work. But I didn't see anything in the area of CE. So just, kind of a broad scope of all the healthcare provider or all the healthcare boards within DCA.
Yes, Kathy?
As an attorney, I know there's CE or equivalent. Are there pro bono? Is that allowed in the legal field as far as pro bono, legal aid types of things?
So not directly for CE credit, but there are accommodations made. If you provide certain pro bono, you get free continuing education through the bar. So there's accommodations that are.
But you still have to do the continuing.
You still have to do that.
Got it.
But if you have qualifying pro bono, then you get accommodations through the bar.
Dr. Sullivan?
Yeah, Dr. Drusis is on our advisory board, and this came up indirectly, and his immediate comment is, I don't want any.
And explain who he is.
he's the head of the Riverside Animal Control. And he said, I don't want any veterinarians coming in here to teach them how to do spays and neuters. They're too slow. So his response was kind of negative to the plan. I, on the other hand, I mean, I guard the CE with everything I have because I think it is crucial and critical, and I think this is, I'm sorry to say, but I think this is watering down our CE. And the only time I've done CE with the by book or online has been my accreditation for my health certificate to be able to sign health certificates, and that's put out by a federal ag program. So I think we have to be really careful in this. I know other states have done it. I was surprised at the states that did do it. New York has probably the most rigid requirements for continuing education and fees towards it. So I was really surprised that they participate in it, but I'm cautious here.
36 hours every 2 years is really, I think, a pretty low number. I mean, I personally will get 50 to 70 hours a year, just because I like CE and like to go to meetings, and like to read.
And
I
your
don't even
show
count the
off.
stuff I read. So, and there are many veterinarians out who need that CE. So I'm kind of with Dick there. I also my opinion, I would advise you to take out the part about this is a opportunity for veterinarians to gain the latest knowledge in perioperative procedures, effective anesthesia protocols, and more efficient surgical techniques.
Yeah.
I live in a community where I spend a lot of my time trying to correct the complications I see that come out of the spay and neuter facilities.
By public
lot.
shelters and
By a private shelter.
by private shelters.
It's a private shelter, but a very well-known private shelter. And yes, I mean, they need to come to my place to learn how to do surgery. So it's kind of, irritating when a veterinarian reads that, so I'd take that part out. That's my opinion. Okay, where are we?
Just asking for comments.
Any other comments from the board?
Is there any other questions for Susan?
Any other comments from the public?
So do we motion not to support this?
I mean, you can
Motion to.
watch it. You have your options to do what you would do with any other piece of legislation, whether that be support, oppose, watch, track, do nothing. You don't have to do anything. I mean, I think you'd probably want to continue to track it to see what happens with it, but that's at the
There may be,
discretion of the board.
I'm not sure in the discussion if there might not be an opposed.
I think we should watch it. Motion to watch.
Okay.
I'll second. Is there a second? Okay.
Okay.
Any other comment?
I mean, because I really do think that there's an issue that needs to be addressed. And I want everyone to know that we care about that.
Yes. Any other comment from the public?
We need
Call for the vote?
overpopulation.
Dr. Waterhouse?
Yes.
Dr. Sullivan?
Yes.
Dr. Nunez?
Yes.
Judy Mancuso?
Yes.
Kathy Bowler?
Yes.
Jennifer Laredo?
Yes.
Motion carries. Okay, so the next one's easy. I keep saying that, and it doesn't
Yeah.
turn out to be as easy as I want it to be. This just allows for the board to administer the veterinary law exam by way of an electronic format as opposed to just snail mail. And that is as simple as it is, I promise.
I have a question.
Oh dear. Tara, seriously.
I apologize in advance. I reviewed this language before it was part of the meeting materials, and one of the questions was whether or not this exam, which may be administered as a survey, would be administered electronically through the board's website. So if that's the case, I don't think this language captures that.
Ethan, do you want to approach? You've gotten off way too easy today, so.
I don't have Ethan in with the board. The current plan was not to administer through the website. We were going to actually use a SurveyMonkey survey tool, but I think if we covered our bases saying electronic, that might suffice, because that's what we're trying to do currently, just find a way to electronically administer it, not by snail mail, as Emery had said, and the SurveyMonkey tool is one. It's not a survey per se, it's an actual exam. I don't know how we would do it through the website, though. I'm not a technical expert.
Well, I was trying to provide for electronic
Yeah.
administration, but what is that? Is that electronic mail or electronic?
It would be via the website. It
Right.
would just be like, you know.
Right.
Via the VMB website, right? Is that where they come? No, it's the official test site.
It's a separate, it's accessed via the internet on a separate site that you get access to via our website. So I don't know if you'd consider that via our website.
So yeah, it would be something like the official blah, blah, blah through the VMB site. Be very specific.
But Ethan, doesn't it say email because we send them an email that has their code and everything where they, yes, and.
That would be one way, yeah, to notify them. We prefer to operate via email.
Yeah.
The test would not be an email exchange per se. It would be, like you
Right,
said, a code.
right. So
to
the
the
code to get
external
in, yeah.
site.
So the administration of it actually occurs electronically, but not through email. It's
No.
just a notice.
Yeah, of how to
through
get in.
electronic
The email
mail.
is just the tool to notify them.
So can't we just add, or by administered by regular mail or through electronic means, email or by regular mail and email?
Well, I think what she's saying, I mean, you could say, by email through an online portal or something like that. I mean, couldn't you?
Okay, so,
I
you know,
the email's not the text.
for purposes of moving this along, I think we could go with just adding, strike or both by regular mail and email and add or by electronic means.
Yep.
And then move forward with this proposal, because if there's a problem, I assume Ledge Council would catch it if this was inconsistent with other uses of electronic means. And it could just be tweaked at that
Yeah,
point.
and it may change from that SurveyMonkey tool too, so I'd like to cover that contingency as well.
And I think it'll still
Well, let's see.
retain by regular mail, email, or by electronic means.
Yeah. That
Yeah.
was SurveyMonkey.
Yeah, okay.
We have a
So
second?
moved. Second.
Any other comment? Any comment from the public? Call for the vote?
I'm still.
Oh, she's still writing, so hang on.
Okay, Dr. Waterhouse?
Yes.
Dr. Sullivan?
Yes.
Dr. Nunez?
Yes.
Judy Mancuso?
Yes.
Kathy Bowler?
Yes.
Jennifer Laredo?
Yes.
Okay, so as amended, I have that. And then the last one, H, these you've all approved already. It's just an update to what's happening with them. You approved all these legislative proposals. We consider these more technical cleanup things. And we went through all of these in great detail at the last meeting. This is just an update that I did submit these to the Senate Business Professions and Economic Development Committee, and they agreed to carry these in a committee bill for us. So the other two proposals we discussed today, which are the premises permit application and discipline of MGL and the veterinary law exam being administered through electronic means, would also be included in that committee bill.
So we already approved this.
Yeah.
Yeah. Yay. Can I ask a question? Does this go all the way through 5 veterinary student exemption? Are we still, or is it?
Yeah, this
Okay,
is the whole
because I
thing.
found that there's a typo.
Oh, okay. Yeah, let me know where it is.
It's on 5 under proposed solution.
Oh, yeah, that won't change. That's just what we sent over to him.
Oh, okay, so it doesn't matter.
Yeah,
So it should
won't
say
be
appropriately
published.
vetted.
Yeah.
Okay, got it.
Well, we have a public comment.
Yeah.
Yeah, why don't we get a well, no, you don't need a motion because you guys have already approved that. Yeah.
So we don't need, okay.
Yeah.
I suppose it's too late, but there had been a discussion about when you were removing the veterinary graduates from being able to be RVTs after a year, of adding an eligibility category that they could take the RVT exams.
Mhm.
Has that been done? Is that part of this?
Go ahead, Tara.
Well, what's required for the RVT exam?
Well, there are several
They have to-
eligibility categories, being the graduate of veterinary school is not one of them.
Right. And so that would happen by regulation. So what we're trying to do is get the statute cleaned up so that that loophole doesn't exist anymore. And then by regulation, handle the eligibility category for an RVT or for someone who graduates from a veterinary school, a recognized veterinary program, to be able to make application as an RVT.
Of course, that'll be 4 years from now.
Who the heck is gonna remember this?
I don't know.
Yeah.
I'm gonna make notes.
So,
I'm doing a transition.
part of the concern was affecting individuals who are already working in this capacity. So we made sure to provide for a sunset or a delay of operation to give those individuals time to figure out what their next step is, either to,
I mean, until the new eligibility category is added, they don't have, well, they can use the alternate route right now,
right.
when their veterinary education would qualify under the alternate route. And they probably have 2.5 years of experience, so they may be able to use the alternate route. But of course, you already have a proposal to eliminate the alternate route, so. Interesting.
Okay, thank you. It's through the school, they have to go to an alternate route program. Yeah.
Yeah, it's the alternate.
Yeah,
Yes.
yeah, the ad hoc.
Yes.
Okay. That's it for legislation.
Okay, so we're moving to, okay, where are we?
Well, we're gonna move back
Agenda
up.
item number 10.
10 on corporate practice. Yeah, we've moved around, so the only other item we were gonna complete today is item 10, and then 8 and 9 are being moved to tomorrow.
Okay, so just a quick introductory comment on this issue. If, I'm assuming everyone read my glorious 6-page memo.
I don't think you did enough research on it.
More legal counsel research, please. So generally speaking, it's very unclear, especially to staff of boards, healing arts boards in particular, how to enforce the common law ban on corporate practice of medicine. That concept was established over time to protect consumers from the commercialization of medical services, but we seem to have moved away from really enforcing that, because not only do we have general corporations, we have professional corporations. It's unclear whether or not you have to be a professional corporation, and that's the only way you can own the practice. In theory, we know we can probably link it up somehow to the Medical Practice Act, but that doesn't apply to veterinary medicine. Because the Medical Practice Act doesn't apply to animals. So to address general corporate ownership of premises, which unfortunately is now being interchangeably used with practice, now general corporations can own and operate a practice, and they're actually filing their corporate documents with the Secretary of State with those phrases on there. So they're legitimate, but we need to draw a clearer line to stop the corporate interests from interfering with the practice of veterinary medicine. So I've got some suggestions on how to do that. I've drawn these statutory proposals from existing statutes under the Medical Practice Act, as well as other medical-related provisions relating to clinics. I know this is a very complex issue because it touches on common law, corporations code, business and professions code. And, under the Veterinary Medicine Practice Act, you've got licensure of veterinarians, and that's the practice of veterinary medicine, but you also have the registration of the premises. So it really, all the different layers make this a bit confusing. So I've tried to break it down. I don't expect that we'll go over these statutory proposals, but I at least wanted to get you guys thinking about the problem and how we could fix it, because we need to protect consumers from corporate interests. What that looks like today is large corporations that own and operate services and sell products for animals. They hire veterinarians on the side. They then offer these contracts to the veterinarians to give them incentives to sell the corporation's animal products and services. So, we just need to provide a clear line where the practice of medicine begins and where the ownership of the premises or practice ends. So it's not just addressing the general corporate ownership and practice problem, but also any loopholes that might be identified by general corporations wherein they could enter into contracts to provide management services to a veterinary practice. And by providing management services, you're now contracting for laboratory services with only specified contractors. You're only stocking the veterinary practice with particular animal products. So I've got a statute that gets at the management services organization contract situation, and then I've got regulations here. The regulations are completely modeled after the Texas MSO provisions, which I found very thorough. And the point here is that these general corporations already own the premises and/or practice. We're not going to walk that back at this point. But we can draw the line between ownership and practice of veterinary medicine. And we need to make it clear on how to enforce that. And so that's the purpose here. Do we have any discussion?
Dr. Nunez.
You're making a distinction between the veterinary corporations and management service organizations. I'm not sure why you've made that distinction. And the other question I have is, I think the concept of, or the question on a corporation influencing a veterinarian's medical opinion by encouraging them to sell products and so forth. Is that something that you're implying is in the employment contract?
Yes.
Or is that something that is
Yes.
being done outside the employment contract?
It's in the employment contract between the veterinarian and the corporation. And unlicensed individuals are part of that contracting process.
So it's specifically the employment contract that you have an issue with?
No, it's basically the concept and the feeling of the veterinarian and anyone else working there that the corporation owns and controls. So we need to push the control of the veterinary medicine practice back. And the contract is evidence of the control.
Yeah. Then within an employment contract specifically, for example, your salary is based on a certain percentage of your commission, implying that a veterinarian might do more than what they're professional veterinary opinion would tell them to. But that's not exclusive to corporate ownership because a lot of private practitioners do the same thing.
I don't think
Having-
that's the issue, yeah. I don't think that's the issue.
So this is more.
It's in your memo. You
Well,
mentioned that in your memo.
We're talking about unlicensed practice of medicine, specifically veterinary medicine. And when a general corporation and the individuals who run that corporation, and they are not licensed, start telling the licensed professional what to do, that's what we're trying to get at. In your scenario, Dr. Nunez, if there's a veterinarian licensee owner and they're encroaching on another licensed professional's opinion, that's not this scenario. And with respect to general corporate ownership in one sense and a management services organization in another sense, if the general corporation only owns the premises and we're walking back their ownership or their control of the practice, then they just use the management services contract to get around that line. So we want to attack it on two fronts to protect the consumers from that. And again, these statutory proposals actually provide for the contracts. We know they're already out there. There's no way we can undo those contracts at this point. That's not the goal. The goal is, though, to limit the interference with the practice. So even if those contracts say we can interfere, we can tell you what products to recommend to your animal patients, that would be prohibited.
I have
Right.
a question on 4918A. It says a veterinary clinic or hospital that's owned by a general corporation, foreign corporation, or other, shall be registered with the board. So that's separate from the premises permit? Shall be registered,
No, pursuant
With the
to
board.
section 4853. So that's the premises permit.
so that's,
Yeah.
so.
Right,
that
that's
means the premises
already
permit.
Yeah,
the
that's
requirement,
already-
yeah.
Okay, so this is not a new category of, okay. And I'm not sure are there any current MSO entities? Not that I know of. I mean, not that they couldn't come into being, but I'm not familiar with any current MSOs.
We had an individual who was not affiliated with any association earlier. And she, in her practice, said that, yeah, the MSOs are becoming a larger problem. She also researched corporate practice issues for quite a while and has a volume of information on it. And she was telling me about the Texas stuff, and I'm like, oh, it's already in there. I found it. But the point is that practitioners of law are seeing that the MSOs are doing these types of arrangements to get around the prohibitions on practice.
So on page 4 of the middle part of the second paragraph of your memo, it says that the employment agreements contain net revenue percentage incentives to sell the corporation's animal care products, including vaccinations, flea treatments, vitamins, shampoos, dental products, prescription pet foods, and services, which may or may not be in the best interest of the animal. Consequently, these employment agreements and the commission-based fee structures create an environment where the veterinarians may believe their employment is at risk if they are not selling the corporate animal care products and services to a client. I'm not sure that currently is in their employment contracts. That
Have you seen all the contracts?
I have one myself.
Right, and they may not be in all of them, but they are in some of them. So
I
part of this,
have seen one
yes,
confidentially
yes.
that contains these provisions. It's laid out, it's commission-based, and it's absolutely about pushing the corporation's products and services.
Okay, well, Would we like someone from VCA to address that?
Yeah.
There's other corporations.
Yeah, so you're, if you'd like to make a public comment, you can, you don't have to.
I can make a small one.
Okay.
Services, corporate services.
Hi, my name's Diana Duncan. I'm with VCA. I am not a veterinarian. I just became aware of all of this last night, and I am not well versed in this kind of panel thing. So I guess my first comment would be that I take a little bit of issue to the categorical classification of corporate ownership as if all are the same, because they're not, just like private ownership is not all the same. I can attest to many veterinary hospitals that are privately owned that pressure veterinarians to provide different levels of medicine than any of us might be comfortable with. So I'm just going to say that as a public comment, that this doesn't feel like, this feels like it's an either or kind of dynamic, and that doesn't feel appropriate. In our contracts, we do not pay more or less on products that may or may not be private labeled for our company. And we do not prohibit our veterinarians from dispensing or recommending products that are not private labeled by our company. We simply private label things in order to make it more available for them and to make better deals available so that we can then turn those around to our clients. So it is not a mechanism to force prescription of certain products. Those products are actually typically chosen by our veterinarians, and we then go out and negotiate agreements for them.
That doesn't sound like the conduct we're looking at.
Yeah.
That doesn't sound like your VCA arrangement is inserting itself into the practice.
Right, and that's what I would say, is I don't feel we are. I feel that I am there as a non-licensed professional to support my veterinarians in practicing the best level of medicine they can.
Mm-hmm.
And my contention would be that in many cases, we are raising the level of medicine provided by those hospitals through our ownership and our support of them. And so I just am concerned with the categorical classifications. And I guess my other comment would simply be that many practice owners in the state of California, in any state, but we're all focused on California, have no other options to an exit strategy other than to sell to a corporation based on the size and volume of their hospital. And so I think as a state, as a committee, and as an industry, we want to be cautious about doing things that might prohibit a corporation's ability to do business in a state, because then we may prohibit veterinarians' ability to retire, move on to their next plans in life.
My memo actually talks about that.
Exactly.
Like I said, I just read it last night,
Okay.
very briefly. So
the approach is extremely conservative because, there's a recognition that there are veterinarians who are aging out, retiring. There's nobody else to take over the practice. Perhaps they're in a rural area that may be underserved. And their only option is selling to a general corporation.
The problem is that the corporations aren't buying those practices. They're not. They're only buying the bigger practices.
Mm-hmm. Well,
that's not always true.
In either event,
I'm sorry?
For the most part.
this is not about prohibiting corporate ownership. It's about making sure that there's a line, that the corporation is not crossing to practice veterinary medicine or insert itself over the professional opinion. That's it. And, I'm sure perhaps this might sound a little heavy-handed. That's not the intent of the memo. The intent is just to say corporate practice of medicine has been prohibited in California for over 100 years. Unfortunately, we've kind of walked away from that just insofar as our statutes aren't clear. But the goal of this proposal is to make sure that those arrangements can continue with respect to ownership, but practice insertion is what we need to take a look at, discuss, and perhaps address.
Dr. Nunez?
I agreed with most things you said, except for the last point. This board is not it's not the responsibility of this board to take care of the retirement funds of veterinarians or who they're going to sell to. So that point I don't agree with, but I would be in agreement if there are some corporations that actually have in their employment contract, which VCA does not, that you must sell these products, then we definitely should prohibit that.
Dr. Sullivan.
I want to go back to the sentence that we were discussing before. There's one part I don't understand, and that's, again, in page 4 of the memo, second paragraph, we're talking about the employment agreements contain net revenue percentages, blah, 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 and prescription pet foods and services. Isn't all of the execution of diagnosing and treatment services? It would not be unique to a practice. So I just the word services, I don't think, at least my understanding, doesn't look like it fits in there. Because everything we do besides selling those products are services.
Right, but the services I'm talking about that may or may not be in the best interest of the animal are puppy packages for, that are really aimed at all dogs. But what we're talking about is the patient is actually a particular breed, and that general one-size-fits-all puppy package with, 3-month, 6-month service provisions to it isn't necessarily good for that particular breed. That's what, it's a, the services are kind of wrapped into these packages that are now being pushed in the larger animal hospital context. And so when I add services here, it's about that
We need
package.
to define it a little better.
Yeah.
Well, this isn't language. This is just background.
Oh, I know,
Yeah.
but I
Yeah.
didn't understand what it meant.
So what it really boils down to is that in looking at some contracts, and then we had this discussion generally at a CVMA Board of Governors meetings, and we were talking about, there are corporate entities that have a standard. If a dog comes in and they're under the age of 5, this is what we expect you to do. If they're between the ages of 5 and 8, there's these products and these services. If they're a geriatric or elderly patient, it's this. So the discretion then is not the veterinarian's discretion, it's the corporate ownership that's saying for all dogs maybe it's a given breed, maybe it's within a certain age group, we have this expectation.
Well, the example that I've heard from an associate of one of these practices is that they're not even packages.
Yeah.
This is a flow chart, and if you don't do, if a dog comes in with diarrhea and you don't do A, B, C, D, E, and F, you get dinged. So that's the protocol that they're set. Now that is what I think we're trying to address. Okay.
It seems like it's one of the things, but also you got to sell this shampoo and you got to sell this kind of food instead of looking outside that there's a better shampoo.
Or this insurance policy.
Any of this, the veterinarian needs freedom.
The general healthcare needs of that particular animal.
Instead of the corporation setting the standard of care.
With all due respect, I would say that I know of many private practitioners that have those same requirements in their own hospitals and with their doctors. So I would suggest that maybe the approach would be to limit that kind of behavior regardless of whether it's happening on behalf of a corporation or a private practitioner.
And I appreciate that, and that is something that we need to look at as well. This is really dealing with abdication of a license to an unlicensed individual. So in the example that you give, if you have an unlicensed hospital owner, let's say you have I own a veterinary hospital, I'm not a veterinarian, and I'm dictating to Dr. Waterhouse what she can do based on her employment agreement. That is a violation as well. It's actually a violation of 650. There's a code section that covers some of that. But if we need to be more expansive, all unlicensed individuals, there may be a separate avenue that we need to address for that. The reason we're addressing corporate practice is because there has been a vast amount of confusion for many, many years about what type of corporate entity can own and operate a veterinary practice in the state of California. So a purist read of the Moscone Knox says it should be a professional law corporation, but it doesn't say it has to be. It just says that's how you can incorporate. So it appears there was some intent there for those corporate ownership practices to organize under the professional corporation structure. That hasn't been enforced. So now we have general law corporations and S-corps and other various types of corporations owning veterinary practices. And we've now been made aware of the fact that there's some influence on the delivery of medical services from this unlicensed corporate entity. And that's what we're trying to prevent for the betterment of the animal and the client.
Okay, Kathy's next.
I was going to say, actually, I found the memo was interesting, informative, but I thought the proposed regulations that were drafted by Tara were they made sense, they were reasonable, and I think I'd separate them from the memo, and in looking at these, now it may need more cooking, but I understood a lot better when I read the regulations about the whole system, so I thought they were very clean. Anyway, just my opinion.
I had another comment.
Oh, sorry, yes, Dr. Nunez.
I know it's maddening, but the argument saying, well, private practitioners do it too, can't really be applied. And you have to have been doing this for a long time to understand why. It goes way back to the Sherman Antitrust Act that we have a monopoly on practicing veterinary medicine, and the way that we have recourse for bad veterinarians is through regulation and oversight and inspections and complaint process. So veterinarians truly can do whatever they want, but sooner or later, if they're doing something bad, we'll find out. But the fact is we can't have people who are not veterinarians, like corporations, dictate the practice of veterinary medicine.
I do have a question on the last page, page 6, under 2095A. Under, upon request of the Board of Veterinary Corporation, shall make available for inspection or provide copies of the following. And then it lists all those things. So when would the board do this? Just when they're inspected? When there's a complaint?
Upon request. So
Upon
it would
request.
be if
Yes,
there
but
was
why
some
would-
notion,
why would-
because we've received some sort of complaint or allegation, and it gives the board the right then to go in and say, provide us your incorporation documents from the Secretary of State, provide us your ownership agreements between any director, officer, owner, shareholder, the employment contracts with the veterinarians. So it would be the same way that we do our enforcement-related
Right.
inspections.
But, okay, but so will, if they inspect a BCA hospital or Banfield or whoever, are they gonna ask for these?
No, not just on a general
So it'll be on a
inspection.
complaint?
Yes.
Okay.
And it's done with privacy and proprietary information. That it's
That
not a
can't
public.
be disclosed,
Yeah,
right?
okay.
So I don't think the expectation is for the board to adopt all this today. Tara did a valiant job at trying to wrap her arms around a very, very complicated issue. We want to get this information out there to invite discussion and to promote some inspection of where we see the problems. So perhaps this should continue, and we should ask for people to come to the next board meeting and comment on this. I think that would be a really wise thing for the board to do, and we'll hear from some of these other corporate entities.
Wow.
It's a very complicated issue, so may I suggest that we do what we often do with complicated issues and kick it to the MDC?
I knew you.
Okay, Tara knew that was going to happen. So philosophically, the MDC, by statute, is charged with reviewing things that have to do with scope of practice, like the actual practice of medicine, education, and enforcement-related issues. Arguably, this could be an enforcement-related issue, but this really is more of a legal framework than it is kind of a day-to-day practice issue.
It's unlicensed activity.
Yeah, so I don't see how the MDC is really going to provide any more research or input because it really is a legal matter.
Well, and at some point, we have to vote on it and do something. So I don't know that just kicking it down for more discussion, I mean, it looks like she did an amazing job, above and beyond.
Yes, it's a
Tara.
beautiful document, but I think
Thank you.
it does need more discussion by the stakeholders. Yeah.
Yeah, and I would strongly recommend that we do not include it in the next board meeting. I think we need, if we're getting a new executive officer, we need to get that person kind of up to speed on issues before we throw that into them.
Oh my gosh.
What?
FYI.
Oh my gosh.
Did somebody not know that?
You're gonna make me cry.
Not officially. When send it to somebody.
Well, we could.
Yeah, because our May agenda is fairly.
Filling up.
Is filling up
Filling.
quickly.
Quite.
I would just advise this board to not lose momentum on this and all of the work that Tara's put into it, to keep this in the framework of things to continue to discuss.
Can we?
Yeah.
Is it possible to put it, even though it's not a regulatory, it's not official, but put it for public comment to come up and have it scheduled at, a board in the future?
Yeah, you could do
So
like an
it's
August
actually-
meeting, public hearing.
Right.
You could do a public hearing in August just to discuss the issue like we did with animal
Yeah.
rehab.
What do you think?
It can't just get, I think we do that. We
I mean,
can't
I
just
do
let it
agree
go
with-
indefinitely.
Let's form a task force.
Not a task force, Mark.
Anne Marie, let's do a task force.
Do you want to chair that? Do you want to chair that task force? Okay, so I'm going to put on, it's for tomorrow when we talk about future agenda items. For the August meeting, I will add a public hearing on corporate practice. Does that sound reasonable?
Sounds reasonable.
Okay.
Anne Marie, you promised to come back every
Yeah,
meeting.
for that, absolutely. Okay.
Is that, are we doing anything else?
Not today.
Okay.
Any public comments?
Oh, poor Charlie.
Any other public comment? And, okay, so.
We need a motion to, oh, do we, no, we don't, because
No,
we're not
not
adjourning, we're recessing.
We're recessing.
Okay,
So,
never mind.
We're in recess until tomorrow morning at 9 a.m.
Recess always sounded fun.
It did until now.
It's not.
Until